Thank you for the introduction. And first of all, I would like to acknowledge my co-authors and especially Jonathan Kellon, who is the PhD student in charge of this study, which comes from a collaboration between two research labs in France and a university hospital. So this work was conducted with the view to treat twin-to-twin transfusion syndrome, which comes from identical twin pregnancies, and it appears when two or more fetuses share a chorion and hence a single placenta. And in some cases, there is a disproportionate blood supply, resulting in high morbidity and even mortality of the two fetuses. This disproportionate blood supplies comes from interconnected blood vessels called anastomosis, and in that case, blood is transferred disproportionately from one team, called the donor, and the other, called the recipient. To date, the main treatment is fetoscopy. It means that it is endoscopic surgery that uses laser in order to coagulate this kind of anastomosis between blood vessels. Coagulation may be selective, or a line can be performed, a line of coagulation can be performed in order to separate the placenta into two parts, one for each twin. However, fetoscopy is an invasive technique which is responsible for fetal and maternal complication, which can affect the neonatal outcome. So for all these reasons, we think that there is a place for a HIFU treatment that can produce this kind of coagulation inside the placenta in a totally non-invasive way. So for doing that, we used a toroidal transducer that has been developed by our group several years ago. And the advantage of using a toroidal transducer rather than a spherical one is that we can significantly increase the size and the shape of the ablation zone. The following parameters were used for our transducer. The working frequency was 2.5 megahertz. The radius of curvature was 7 centimeters in order to be able to treat the deepest regions. And the diameter was 7 centimeters in order to allow the user to use the device by hand. The transducer is divided into 32 concentric rings in order to change the shape and the depth of the focus using electronic beam steering. There is a central opening in the center of the transducer in order to place an ultrasound imaging probe working at 7.5 megahertz in order to guide the treatment. So this is the probe that has been developed based on this principle, with the HIFU emitters here in black and the ultrasound imaging probe in the center. And we previously demonstrated in the liver that using this particular shape for the transducer, we can significantly increase the ablation rate at distance from the skin without any damages in intervening tissues. So for treating the placenta, we first conducted an in vitro study in order to measure the attenuation of placental tissues according to the gestational ages using a conventional transmission technique. And we show in 12 samples that the attenuation increases as a function of the gestational age from 0.07 Nepper per centimeter per megahertz up to 0.1 Nepper per centimeter per megahertz due to the presence of calcification during gestation. We also measured the attenuation of skin and subcutaneous tissues such as fat and muscle in order to take into account the attenuation of these tissues, which is very high, we measured 12 Nepr per centimeter and per megahertz. And so for treating non-invasively, we have to take into account the thickness of these layers and the thickness of the placenta to determine the correct acoustic parameters to use. And this was done first using numerical model. So thanks to these measurements and previous simulations, we then performed in vitro ablations. The probe was mounted on a motorized arm. Tissues were placed in warm degaussed water, and there is a cooling circuit for the transducer. Placental tissues were placed down to different thickness of skin, fat, and muscle, and the probe was placed in contact with the skin. And we adjust the acoustic parameters according to the thickness of the subcutaneous tissues. So this is the HIFU lesions we obtained in vitro in the placental tissues. So these are two examples of HIFU lesion in the placenta without any damages in intervening tissues. And this is a juxtaposition of several single HIFU lesions in order to demonstrate that we can juxtapose lesions without any space between the coagulated zone. We have not observed any damages in the abdominal wall or in the intervening placental tissues. We were able to spare up to 18 millimeters of tissues with about 10 millimeters of skin between the probe and the placenta. So thanks to these results, we then conducted an in vivo study in order to demonstrate that we can treat the placenta non-invasively. And for doing that, we used 8 pregnant monkeys with a gestational age of on average 72 days, and 13 HIFU exposures have been performed. The HIFU device was held by hand and placed on the skin of the animals. 2 thermocouples were used, one for measuring the temperature inside the skin and one for measuring the temperature of the intramniotic liquid. This is the ultrasound images we obtained during the treatment. So the placenta is there and there. This is the head of the fetus. And this is what we observed right after one HIFU ablation. It is a hyperechoic region in the placenta due to boiling that has been produced by HIFU without any evidence of changes in ultrasound images in intervening tissues. Several minutes after each HIFU exposure, the temperature of tissues cooled down, and we can observe a residual modification of echogenicity, although it is not obvious on these images, but we can see a hypoechoic region at the location of the treatment. This is an example of one single HIFU lesion that has been produced in the placenta with a histological confirmation of the coagulation that has been produced by HIFU. This is the sonication parameters, and the dimensions of the 13 HIFU lesions were on average a diameter of about 7 millimeters and a depth of about 4 millimeters. There was no modification of the skin temperature during treatment, no modification of the intramniotic temperature, and no modification of the fetal heart rate or the maternal heart rate. We observed one complication during the treatment is a burn in the uterine, which was due to a progressive increase of the acoustic power in order to determine the limit that we can use before creating such kind of complications. So to summarize, toroidal HIFU transducer was used to treat placental tissues in a completely non-invasive way. Placental HIFU lesions were created in vitro and in vivo in pregnant monkeys, and this was done at distance from the skin without any damage in intervening tissues. One uterine burn was observed due to a progressive increase of the acoustic power in order to define the maximum limit that we can use according to the dose we can deliver. We observed ultrasound imaging evidence of the HIFU ablation, which appears like a bright spot due to boiling and then a hypoechoic zone when the temperature of tissues has cooled down. And this was at the targeted region, and this was confirmed histologically. These ablations can be performed non-invasively without complication in intervening tissues, but this needs to be validated in more animals, mainly to demonstrate that we can make a line of coagulation, and then maybe we can undertake a clinical study. So thank you for your attention.